Hello everyone, welcome to my YouTube channel. First of all, thank you for all the immense love that you guys are giving me. Today, in this video, we'll be talking about Dentigerous cyst. So, Dentigerous cyst, why is it called as Dentigerous? See, Dentigerous cyst is named so because it is a tooth-bearing cyst. Okay, it is called as Dentigerous. Why? Because it is a tooth-bearing cyst. This cyst is also known as follicular cyst. Why? Because there occurs expansion of the follicle when the cyst is formed. That we'll be seeing later on. To introduce, it is a cyst enclosing the crown of an unerupted tooth by the expansion of its follicle, and it is attached to the neck of the tooth or CEJ. So, this cyst encloses the crown. We can see here, this is the crown, and the cyst is completely enclosing the crown. So, this cyst encloses the crown of an unerupted teeth by the expansion of its follicle. This was the follicle of the teeth. It got expanded and the cyst was formed. Along with that, it is attached to the neck or CEJ area. Next, if we look at the etiopathogenesis of the cyst. So, we all know that when a tooth is erupting in the oral cavity, okay, so when a tooth is erupting in the oral cavity, then what happens is it is covered by reduced enamel epithelium. Now, what is reduced enamel epithelium? It is the outer enamel epithelium and the inner enamel epithelium. These both, they are, उनके जो cuboidal cells and they are converted into flattened squamous cells, and then they form the reduced enamel epithelium. This covers the crown, secretes certain enzymes which helps in the eruption of the tooth. Now, what happens is when the tooth is impacted, then what happens? There is a pressure on the follicle. So this is the follicle which covers the tooth. Now, since the tooth is impacted, there is a pressure on the follicle which is built up. Okay. Because of this pressure, the venous outflow of this follicle, it is obstructed. So there is obstruction of the venous outflow. This leads to transudation of the serum and increase leading to, so what happens is all the serum, because of the pressure, there is increased hydrostatic pressure of the pooling fluid. मतलब यहाँ पे जो अंदर fluid आएगा उसका pressure increase हो जाएगा. So there is increased hydrostatic pressure of the pooling fluid. Now, this pressure or this pooling fluid, because of the pressure, what does it do? It separates the reduced enamel epithelium from the crown. See, here, this is the separation which is created between the reduced enamel epithelium and the crown. This was the reduced enamel epithelium, outer and inner layer of reduced enamel epithelium. And this is the separation which is created. So this leads to the development of what we call as dentigerous cyst. This is how dentigerous cyst is formed. And this theory of formation of dentigerous cyst is known as the Main's theory for the etiopathogenesis of dentigerous cyst. Now, Tenkates has classified dentigerous cyst based on etiology into three different types. Based on etiology, Tenkates has classified dentigerous cyst into three different types. What is it? First, they are classified into intrafollicular and extrafollicular type. This intrafollicular and extrafollicular type, they are again classified into two types. So, the etiology or exact etiology of the extrafollicular type of dentigerous cyst is not known. Now, the intrafollicular type, it is reclassified into two types. First one, which we have seen earlier, that is, there is accumulation of fluid in between the crown, this is the crown, and the reduced enamel epithelium. So, if the fluid accumulates between the crown and the reduced enamel epithelium, this is one type of intrafollicular dentigerous cyst. Sometimes what happens is the inner enamel epithelium remains attached to the tooth or the crown and the outer enamel epithelium separates. Means there is accumulation of fluid between the inner enamel epithelium and the outer enamel epithelium. So this also gives rise to intrafollicular type of dentigerous cyst. Next, moving over to the clinical features. So it is most commonly seen in second or third decade of life. It has a female predilection. And if we talk about the site predilection, then it is seen mostly in the mandibular third molar region because the third molars are most commonly impacted. So it is seen mostly in the mandibular third molar region. Along with that, it can be seen with impacted, unerupted or embedded tooth and complex, compound or supernumerary tooth. So it is seen in the mandibular third molar region. Along with that, it can be seen with impacted, unerupted, embedded tooth or complex, compound and supernumerary tooth. This is associated with pain and paresthesia, and there is mobility of adjacent teeth seen sometimes. Now, if we talk about the radiographic features, in general, what happens is the radiographic feature depends on the speed with which the cyst is formed. If the cystic growth is slow, then it has a well-defined radiolucent border, which is also sclerotic. But if it is rapid, then it has an ill-defined border. Okay, if the cystic growth is rapid, then it has an ill-defined border. Now, radiographically, dentigerous cyst can be classified into three types. So it has three radiographic types. What are those? They are CLC. That is central, lateral and circumferential. Now what is the central type? In the central type, there is symmetrical enlargement of the cyst around the crown. Whereas in the lateral type, there is increased dilation in one side. This is most commonly seen in partially erupted teeth. And in the circumferential type, the cystic cavity envelops the crown. So the complete crown it appears to be enveloped within the cyst. These are the three different radiographical types of dentigerous cyst. Now, if we talk about the histopathological features. So, this is how the histopathological diagram of dentigerous cyst looks like. It has enamel space, dentine, and then comes the cystic lining. So, the cystic lining, it resembles the reduced enamel epithelium. What is it? It is basically 2 to 4 cell layer flat cuboidal cells resembling the reduced enamel epithelium. Now, if there is an increase in the inflammatory condition, then what happens? This cystic lining, it proliferates and gives rise to retirages. Along with that, sometimes Rushton bodies of hemopoietic origin can also be seen in the cystic lining or in this reduced enamel epithelial lining. And this cystic lining follows the Vickers and Golin criteria. So what is the Vickers and Golin criteria? As we all know, it is the cells are having hyperchromatic basal cell nuclei. They have a palisading arrangement and also polarization of the nuclei. The nuclei are palisading and polarized. Along with that, there is cytoplasmic vacuolization plus intercellular spacing of the lining epithelium. And there is budding and protruding of the epithelial islands from the lining epithelium. So these are the 4 characteristic features of the Vickers and Golin criteria. Now, if you look at the connective tissue, the connective tissue wall has numerous small islands, cords, or remnants, whatever we can say. There are numerous small islands, cords, or remnants of the odontogenic epithelium which are seen in the connective tissue. And there is numerous immature fibroblast and collagen fiber also present. Next, if you look at the treatment option, as discussed in OKC, the treatment option here also is either enucleation or marsupialization depending on the size of the cyst. Next, if you talk about potential complications which are associated with dentigerous cyst, if there is incomplete removal of the cyst, it can reoccur. First. Second, the cystic lining or the rests of the odontogenic epithelium in the cystic capsule, these two, that is, see, this is the cystic lining and these are the rest of the cystic epithelium. So these two can give rise to either ameloblastoma or epidermoid carcinoma. Along with that, the cyst, if it has mucous cells, then it can give rise to mucoepidermoid carcinoma. So these are the potential complications which are associated with dentigerous cyst. This is it about the dentigerous cyst. Thank you.